now it is my pleasure to move on with our next talk with Professor Dr. Franz Vollenweider from the University of Zurich, who is co-director of the Center for Psychiatric Research, director of Neuropsychopharmacology and Brain Imaging Unit, and professor of Psychiatry in the School of Medicine at the University of Zurich. He's also director of the Heffter Research Center, Zurich for Consciousness Study, which he founded in 1998 and incorporated into his research group. His research interest is focused on the neuronal basis of affective and psychotic disorders, as well as the foundations of psychedelic and non-psychedelic-induced mental states, using concepts from cognitive science, neuroscience, and systems biology. Professor Vollenweider's current research investigates the acute and sustaining effects of psilocybin and LSD on the sense of self, emotion, regulation, and social interaction in healthy subjects, depression, and in substance use disorders. However, today he's with us with a very different topic. And the talk is called 30 Years of Psychedelic Research in Switzerland, Looking Back to the Future. Now let us welcome Professor Vollenweider. The stage is yours. We're very happy to have you here. Thank you for coming.
Thank you so much. Can you give me my presentation free? Yeah.
Yeah, you should be able to share your screen. It's probably at the bottom of your screen.
Yes.
Yeah.
Yes.
Wonderful.
Thanks. So, okay. Welcome you to my talk. Today I would like to give you a kind of overview what has happened in the past 30 years and how we have established the research after a pause of almost 40 years. Even there was some research in Switzerland during the 70s, 80s, and 90s. So let's begin with, our hospital is well known for the discovery or the definition of schizophrenia at the beginning of the century through Bleuler. The other interesting person was Carl Gustav Jung, who was here for a certain time. So the hospital has a background into, on the one hand, psychotic research, research into the deep psychology, and later on then a kind of mixture, also starting the psychedelic research in Zurich. Here I would like to give you just a short overview about the timetable and some peoples that were involved. After Hoffman had discovered LSD in 1943, it came to our hospital, and Kondrau made the first studies into healthy subjects, and somewhat later on into depression. They did all kinds of things in schizophrenia patient too. And already at that time, Bleuler said, yeah, psychedelics are not really compounds that may mimic schizophrenic-like psychosis. So there was some evidence in terms of self-dissolution and ego pathology at quite high doses. Later on in 1955, after Hoffman had discovered psilocybin, quasi not discovered, but synthesized and isolated from magic mushroom, Kniers in Switzerland started a whole bunch of research into psilocybin that was used then up about to the 80s in some limited spaces in Switzerland as a treatment tool. Later on, in 1988, it was discovered that LSD has some agonist activity at serotonin receptors. So far, everybody has thought it's an antagonist. So that picture changed. And in the meantime, somewhat in parallel, ketamine was coming into research. First, it was done research with PCP as the mother compound of ketamine, And I joined then the institute in 1989. So there were several epochs. In the beginning, people thought it's a model of psychosis, but then during the 70s and 80s, psychologists like Adi Dietrich were much more interested in the effect in healthy subjects and in meditation. Already at that time. There were done some studies. So there was a background when I came to the clinic. People were quite open, and Switzerland allowed to do research with the compound based on approval by the ethics committee and the Swiss Authority of Health. The main driving factors was Dietrich, Scharfetter, and Maurer under Schulangst at that time. So let's go on. So what I want to give you is a little bit a background how I came into that kind of research. When I started after education in biochemistry and medicine, I was joining the Gerwiller lab, who was quite at the front at that time because Scott Thompson and Bert Gerwiller worked on the NMDA synapse, which was discovered 2 years before I entered the institute. And so at that time, I was working with patch clamp in the hippocampus, and we succeeded filling up cells with fluorescent dyes and demonstrate real time when we stimulate the synapse, how they interact with the rest of the network. So that was really fascinating. And at that time, I used already ketamine, and glutamate came up because it was really a hype that ketamine blocks the NMDA receptor mediated neurotransmission. And glutamate wasn't so discussed, but people became aware that's very important for memory and learning. And it was discussed, is that something new for psychosis? Funny was, John Eccles, the Nobel Prize winner, came often to the institute because he was living in Switzerland and a friend of the boss. So I got attracted into the question, how is neurochemistry related, system-based to the experience? So the institute didn't go into that. I was more or less frustrated. So I switched then to the Psychiatric University Hospital and decided to start my clinical training in psychiatry. In parallel, I got the offer from Schulangst, who was sitting here. He was very interested in the pharmacology in psychiatric patients because that was new in the 70s and 80s. And he was the father, quasi, of clozapine. And he was a close friend of Arvid Carlson, and that was another impact that came into the institute. What is the interaction of dopamine and serotonin? Because I was thinking about LSD, psilocybin, have an effect on the serotonin system. Can we go on and go deeper into that? On the other hand, I was very interested in self-regulation. Because I got attracted through reading things about psychosis, but on the other hand, also certainly about psychedelics. So when I entered in '89, in the first year already, I set up a little group, and I would like to mention Alex Gamma, who was then very attracted doing the first studies into MDMA, controlled study in healthy subject using EEG, then PET, and that was the first contact with Rick Dublin, who was really happy that somebody's doing some controlled research. And that was then extended by Matthias Lichty, who did a bunch of studies into MDMA, which I have no time to go into today. The other thing that was unique, we had the first PET scanner in Switzerland at the Institute for Physical Chemistry. But they weren't really interested in human studies, so I could deal with them. And Nico Linders a Dutch researcher took over the lab and was very close. He was at Hammersmith before. It was called Friston. So Nico was really attracted to going to the idea, how does dopamine, serotonin, glutamate interact? So I have set up in the end of '89 the first study in healthy subjects where we wanted to compare the effect of dopamine and other dopaminergic drugs, releasing dopamine, in comparison to serotonergic drugs or ketamine. That was the really first study I've done, and it was really a challenge because subject had to lay down for an hour in the PET scanner to look at metabolic patterns. So that was unique and new, and gave a lot of echo. And what we found already in the very first study, which is still a matter of debate, is that ketamine, as well as psilocybin and later on and mescaline, lead to certain activation, particularly of higher areas in the anterior cingulate, some frontotemporal areas, and decrease the activity in the thalamus. That was the entering into thinking about how are these things connected. But at that time, we hadn't fMRI. So, and every third scanning was a mess because people moved and we hadn't all the correction. We had no SPM, but Carl started and sent us the first SPM2 tools to analyze data, and it really became fascinating to go slowly over years into a more dynamical access of what's going on in psychedelic states. So the next step was then that we had the first symposium about psychedelics in '94. Shulangst had asked me, can you look who is doing some research worldwide? And it was completely frustrating. There was only Leo Hermle in Germany who did the mescaline study with Becht, and another guy, which I hadn't known so far, was Rich Strassman in the US. And we had invited almost everybody at that Congress in Switzerland because it was just the 50 years anniversary of the discovery of LSD. And the driving factors at that time were certainly Albert Hoffmann, who founded together with Hans-Karl Leuner and Adi Dietrich in Zurich, the European College for the Study of Consciousness. So the college was founded in '86, around '86, and lasted a few years. And we had about 400 members from all kinds of research people to shamanic research, to religion, philosophy. Thomas Metzinger joined in at the very beginning, gave a lot of talks and discussions. So we all were really in a mood and say, oh, let's go for psychedelics and try out to find how these things affect self-regulation. What might be the basis of the self? Nobody had really any idea about that at that time. At that time, then we had a little bit more data, and I started to think about modeling the interplay between frontal areas, basal ganglia, and the thalamus, who is responsible for filtering sensory input. So that was the beginning. And then in '94, Mark Geyer dropped in and organized the first psychedelic meeting at the CIMP, which was really a breakthrough because there hasn't been done anything since the '70s. It was Rick Strassman, Leo Hermle, I, and Mark. And Mark was well known already at that time as the father of sensory gating and psychedelics and altering, filtering of sensory input in animals. So it was a few steps to go to build up the next step. Then '93, Heffter founded the Heffter Institute in the US. Mark brought me together with Steph Nichols. And so we have set up in '95 the Heffter Center at the University of Zurich for consciousness studies. And in 2004, I set up Swiss Neuromatrix Foundation to support all kinds of studies that were not directly linked to medical outcome of psychedelics, but also, for instance, to the processing of music and such things. So we had a center, we had a little money, but we had already at the beginning support from Swiss National Science Foundation, because there was an area where we did the first human studies, and nobody has looked at that so far. Over the years, we found out relatively fastly that if we block the 2A receptor, we can almost virtually block all of the psychedelic effects of psilocybin. Later, I did studies with Catherine Breller, and we showed the same for LSD. So this was one part, but what was obvious, and based on my background, talking with Acharjanian from Yale University, psychedelics activate the glutamate system. And it was very clear at that time that must have an impact on, for instance, the AMPA receptor, which is responsible for neuroplasticity. And in fact, since 2018, it has repeatedly been shown that psychedelics can lead to an increase in synaptogenesis. The question, however, is how is that linked to behavior? We haven't any data, real data in humans. We have only data in animals, and they are complex so far. And some data show that the neuroplasticity is linked to behavioral changes, but some more recent data show it's not. So it depends really on the task you use in animals. And then you have the more complex questions. Can we translate this data into humans? My favorite is the effect on NMDA on learning, because I think that psychedelics have to be embedded in learning paradigms or in behavioral trainings, whatever you think, how you can mix psychedelics with psychotherapy. Now, in the next step, that was instrumental, was Felix Hassell. Felix Hassell was a real great pharmacologist who succeeded to do a number of things nobody was able to do. For instance, he looked at the distribution of psilocybin throughout the brain. Unfortunately, we haven't published this data because we had so many data at that time. And you see that the psychedelics like psilocybin occupy serotonin 2A receptors throughout the brain to a different degree. But the occupancy in the frontal cortex nicely correlates with an experience we call oceanic boundlessness. The next day, we found some reduction of the 2A receptors. And the only link we found so far is that this reduction is linked to improved or enhanced attention capacity. So, but this is something we're working on still for publication. The other thing is what I got attracted then through Dietrich was that at the core of the psychedelic experience is the ego self-dissolution. And we know that medium doses, let's say up to 25 milligrams of psilocybin in a supportive setting rather leads to a positive self-dissolution, what was termed by Dietrich as oceanic boundlessness, or it's also often termed mystical type experience. And this experience can be decomposed by second order scales that were developed over the years by Erich Struderus of my group, who extended quasi the rating scale of Dietrich. But you have to be aware that these alterations, this loosening up to sometimes a dissolution of self-boundaries, mostly there's a residual observer, it's not a complete self-dissolution, even if we gave quite high doses. this alteration is always accompanied by positive emotions if it's an oceanic boundlessness state with insightfulness, altered space-time, spiritual experience. We cannot take this cluster of alterations. We cannot split that. That's a package. And the other package that always comes with that type of experience is visual or perceptual alterations, basically from elementary to complex imagery. And in that cluster, we have a kind of improved or facilitated recollection of memories. Minor alterations we find in scales like acoustic alterations and altered vigilance. So that cluster, let's term that oceanic boundlessness, can nicely be depicted by the mystical experience scale. But also this scale is a composition of experiences, ego loss, unity, positive emotions. So to make the point, if you go into studies, you want to study alterations in a certain domain, you have been aware how these things are intercorrelated. And if you look at statistical outcomes, you often see the scales really correlate up to 0.8. That means, can I really tease out the effects through a subjective experience rating? That's a very critical technical question. So what has been shown in a few recent studies, first starting with the Johns Hopkins studies, demonstrating that psilocybin, 1 or 2 doses, markedly decreased depression symptoms. Similar to the open study, open clinical trial by Robin Carrot-Harris showed that the symptom reduction is persisting. The study by Davis shows the same using a control group and major depression. And our ongoing study is a larger study with preparation phase and repeated MRI and a drop after 1 dose in the MADRS scale, which is not a self-rating scale. And we follow these people, and they got another group with 30 got real placebo. These are preliminary data, but we were surprised that we have embedded these patients insofar that in a therapeutic process and in a preparation that we do mindfulness training here and the whole time and later on, and we do follow up at 3 months and 6 months. So here I want to show that 1 or 2 doses really lead to symptom reduction, which we do not really fully understand, and certainly not why the effect persists. So that's an area of ongoing research. Particularly, you need quite large groups to address this question. But nevertheless, there are some data demonstrating that oceanic boundlessness or mystical type experience have an effect statistically or predict persisting increases in openness and prosocial behavior in healthy subjects, done by Lukas Migielski from our group. That the Johns Hopkins data demonstrate that the total score have an impact on the reduction in anxiety, depression, and Rosman from Carrot-Harris group showed that the change in major depression, therapy-resistant depression, correlates with the oceanic boundlessness score. So this is good data so far, but now the question is, how can we go into the details? Because as said, the mystical type experience is not a single experience, it's a whole cluster of alterations, and detailed work will show what or how it would be interesting to understand what really is has an impact. For instance, is the experience of an altered space-time, is that really important for the experience? So for the outcome. So if we go back to newer neurocognitive models, it has been repeatedly shown also with neuroimaging that depressed patient have a certain increased self-focus, which may be associated on the one hand with an emotional bias, with a negative emotional bias, negative self-attribution, or a cognitive bias, for instance, rumination. And there's a certain decrease in the environmental focus and an increase in body focus, for instance, somatization. So these symptoms or processes, so rather processes like emotion processing, we can better approach with neuroscientific tools than the subjective experience, which still we cannot rate immediately in a scanner. Just here, as we started, we were interested how do these drugs impact emotion processing, and it was interesting to see that even at the unconscious level, and people don't see happy, neutral, and fearful faces, if they they flash up and they don't really realize what's going on, these psychedelics reduce the processing of fearful processing. And at the conscious condition, it's almost a double. So there's some impact of being conscious of the fear and how we deal with that. But it's also a critical finding. Could there be some aspects that we are not even aware? That also raises the question what parts of the psychedelic experiences are important. I put that a little bit forward because there is a tendency now that everything is crunched down to pharmacology, and that would be a pharmacological effect. You don't need to be conscious. So I just want to mention that as a critical point, how things develop in the future. I go with the conscious experience because I think, as I said, that consciousness has some meaning in reinforcement and learning. So we also saw that psychedelics reduce the activity in the amygdala, which is a center of processing of emotions. But here was the interesting thing that the relation to the ventral striatum gets loosened under psychedelics. And that, I think, is really interesting because the ventral striatum is important in saliency detection, whether something is very important and new, and that is brought down through the psychedelics. And I think that is what our patients say, that they are in a state or in a kind of decentered state where they have a broader spectrum to their own emotions and thoughts can reappraisal them, and they have some room to get insight, and they are not just urged to react. So that's an interesting finding that can be further followed up. Then the next thing is how are alterations of the self, how can we look at them? What are the correlates of that? And we know from a number of imaging studies that the default network, the frontal anterior cingulate, prefrontal areas, and the posterior cingulate are really important for the discrimination of self or self-specific information, and the posterior cingulate a little bit more for self-other discrimination. So what Lucas in our group found 2 days after giving psilocybin to trained meditators, and when they relax in the scanner and go in an open meditation again, that the connectivity between frontal areas and posterior areas in the cingulate, more they get is reduced, the connectivity, the better we can predict the outcome 4 months of 4 months follow-up in terms of increased prosocial behavior. That's interesting that the post-acute effect, alteration of a connectivity, predicts an improvement. Catherine Preller also showed that the disconnection of the somatosensory network acutely correlates with the experience of disembodiment. But this is a subjective experience and an acute effect, but nevertheless, it brings us to regions like somatosensory cortex that might be really important in the experience of body self, which is a kind of basis where the self builds up. There are other things that are interesting. I think maybe Catherine has talked about that, so I will just mention that psilocybin alters global functional resting state connectivity in a broad way, but very robust. And over time, when you take the drug and then we measure 24 to 70 minutes, some regions show an increase in connectivity, like the sensory cortices, and the association cortices a decrease. And this LSD was very similar, the pattern, and that was driven by the 2A receptor how should I say, localization throughout the brain. Now from this, we wanted to do another step, and we just recently, 2 weeks ago, we published that study. And we wanted to know how are psychedelics affecting the altered body self in terms of the body. Is quasi the home? If you look at developmental psychology, between the first 4 months and from month 4 to month 7, kids scrabble around, build up an outer body, a border. And to look at how psychedelics affect the body experience, we used somatosensory mismatch paradigm, that is to induce tactile mismatch. Trains of stimuli switched randomly between high intensity and low intensity were applied to the forearm. And if we have this switch and the brain learns to model the predicted income of sensory input to minimize surprise across different body representations, then if you have that deviant, that's a kind of surprise, because the brain learned it should go like this. Now we have a deviation and it starts here. That's a rowing paradigm. And the discrepancy between the predicted and the actual input produces a predictionary signal. In baseline condition or in placebo condition, a number of brain areas that we know are important for regulation of the self, like the frontomedial cortex, anticingulate, the somatosensory cortices, the thalamus, and the insula get activated. Now, under psychedelics, this processing is quite different. First, psilocybin produced expected feeling of unity subjectively, disembodiment we could measure, but simultaneously then we found in the scanner a marked reduction of ventral and dorsal medial frontal cortex activity, among others. And simultaneously in the EEG, it was a co-recording of EEG and fMRI, we found a reduction over frontal cortical electrodes with that reduced mismatch negativity. And that signal, that change really nicely also correlated with this embodiment and the feeling of unity, suggesting that such a task may be really useful in longitudinal studies without drugs, to see whether that basic measure of body experience is changed as an index of how the structure of the self may alter over time through psychedelics and psychotherapy. Without being under any drug, it would be an easy thing to do, and it's not invasive. So Lukas Smilgielski did another self-monitoring task as a potential measure of other processing. And subjects on the EEG got a cue for vocalization and immediately, real time, an auditory feedback. Then they had to rate, was that their own voice or their voice pitch shifted, or another voice pitch shifted. So I had earphones and got that feedback. And in fact, what we found was that psilocybin markedly reduced or blurred discrimination between self and other, and that this effect was in the EEG due to a reduction of a P300-related self-stimulating coding process. Now, when we look, where is that located in the brain, we again found in the suprageneal anterior cortex, in the right insula, and in the superior temporal cortex, that this blurring of discrimination of self-others relates to areas that are discussed highly in the processing of self. And again, this reduction in frontal areas and in the insula, which is important in the sensation of one's own body, visceral signals, and so on, that this correlates nicely with the feeling of unity. So that would be another approach to self-processing before, during, and after psychedelics, and also in longitudinal studies. Now, there are a number of facts we think that are important in psychedelic assisted therapy. One are the alterations in emotion processing, which can be further studied, and that we have more insight of what is important, what aspects. There's the self-processing, which we could approach with certain neurocognitive tasks. And what Catherine Perella has shown, that psychedelics also have an impact on social processing. So if, let's say, egocentricity is changed over the therapy, that may foster the social interaction. And in fact, psychedelics acutely, at least, like psilocybin and LSD, increase empathy, reduce rejection sensitivity. And together, we think that's a package that may help to further investigate certain critical factors for psychotherapy assisted psychedelic research. Now, the last thing I want to show you is a little bit my favorites. I like the combination of mindfulness training and psychedelics, and we have done and still do retreats. We have done 6 retreats so far, and we have planned others with my friend Vanya Palmas in a retreat center where we have studied 5 people on the placebo and 5 people on the psychedelics for research purpose, not for therapeutic purposes. But what was important to show that this thing can be safely done. What we were interested here were predictors like personality factors, previous experience. We have investigated in detail emotion regulation. Do people suppress emotions because they are trained in mindfulness? How non-judgmental they approach their inner experiences, like thinking, thoughts, and emotions. We used all kind of validated scale before they went into the experiment, and we did fMRI scanning at the beginning, and then they went in a 6-day retreat and meditated every day very hard from morning 6 up to 6 in the evening. It was a silent retreat. On day 4, they got half of the group psilocybin, or placebo, and they were again rated in the evening for their subjective effects or their meditation depths and so on, and followed up to 4 months in details and got another fMRI. So what is important is that the placebo group of 20 subjects, that psychedelics enhanced the meditation depth, and that was important. We feared psychedelics may disrupt it, but it was not like that. On the other hand, there also was an effect of mindfulness, acutely certainly. It's not, But the most interesting effect was that psychedelics markedly, compared to the placebo effects, produced a state of oceanic boundlessness, or mystical kind of experience when we use this scale here. And yeah, that was surprising in terms of these people tried to get to that state without drugs. Now, what is interesting that 3 of 20, and later on when we looked at the other retreat data, it looks similar. A few go into these states without drugs, but with psilocybin, almost everybody was up to here compared to these guys. And if you just look at these versus the psilocybin, the people who have no drug, they were similar in the experiences. But on the other hand, if you look at the red curve here, which is the oceanic boundlessness, if you gave the same dose, same kind of people in a laboratory setting, you do not reach that state. That was interesting. Thought disorders were very minor, but again, with the trained people, it were almost nothing, and anxiety was almost 0. So that was very interesting. Now, to finish my talk, we also look at other things like what's the impact of LSD on music processing and emotion. This is just curiosity. For instance, Catherine has shown with Fred Barrett the impact on European harmonies. Looks at tonality tracking and all these things. And in fact, there are regions that get activated and regions enhanced. And but I don't go into this detail. I just want to demonstrate that psychedelics are not just for therapeutic purposes here. They can offer a number of other things that may be improved through psychedelics, like to go an inner ear to train listening to music and have quite a different experience. What we do now, and there's an outlook, since almost 4 years I was talking with my friend Giulio Tononi, how could we use his approach of integrated information theory to look at all the state of consciousness. And Robin Carrot-Harris had already started to look at measures like entropy. Now, what we do here is not a resting state entropy. We use TMS acutely. We just completed that study with psilocybin. And it was a little bit a challenge because we hadn't known, is there some possibly risk if we activate an activated brain through psychedelics, and then we give a magnetic induction and activate the brain more, and that is what you see here within 300 millisec, the signal activation, and how these signals change through psychedelics. And here you see this tremendous effect locally on a certain area when you stimulate here, for instance, or in the motor area, somatosensory area. And then we give the psychedelic, the pattern in space and time is completely changed. And that we can measure through different mathematical approaches like perturbation indices that has been developed by Tononi. What's interesting is that in certain areas we have increased complexity, in certain areas we have decreases. And here I give you a little show, a pulse, and the whole story that you see is 300 millisecond psilocybin, and then statistically we compare this area, and you see the activation, how it goes over the brain in 300 millisec. And that's a completely new approach, how this is linked then to the experience. We can also block or inhibit certain areas instead of stimulating them. And that will be interesting to study the visual effects of psychedelics and what is the leftover if we, for instance, will block visual cortices. That a number of opens up a number of highly interesting research things. Now I wish to thank many of my students like Catherine Preller, Michael Commenter, which I haven't shown any results, today he was very into hallucinatory phenomena of psychedelics. And this is Andreas Ort and John Smallridge who do the TMS study. This is the clinical team. So I thank you very much for your attention.
Thank you for this very insightful talk, Professor Vollenweider. Now, as time is already a little bit advanced, we cannot offer much space for Q&A, but I want to encourage everyone to check back on the Mind community, because this talk was especially dense with information. There's so much we can learn here that I'm sure many of us are not able to even compute in one go. So we'll upload the talk later on the Mind community and you can revisit it. And thank you so much, Professor Vollenweider, for sharing all this insight and so much data. If there's one last question or one request I could ask of you, as an expert that has seen the field for such a long time, has been such a central actor over decades, is there one piece of advice that you could give our next generation, the emerging researchers that are mostly gathered here today, as an advice on their path?
Yes, for me it's very important also when I look how do we go on in Zurich, because I'm semi-retired and just do my hobbies now, doing some research, but not full-time. My advice is to get a really good education, most possibly not to lose track on the psychodynamic aspects. I'm really convinced that you need to have an understanding for the psychic forces in a patient. It's not just the oceanic boundlessness and the mystical type experience, it's the working through of emotions and reorganizing your emotional responses through training. You will have a very good psychedelic experience. Maybe 2 months later, everything comes back in depression because it's not really worked through. And I have the impression many people overestimate the power of the psychedelics per se. It's a really deep interaction, and I'm really sometimes disappointed if I look at I talk to many industry people also. Now it's a real tendency to crunch down everything to pharmacology, as I put a little forward in the talk. That's a nice idea. I think the pharmacology opens up the brain, but you do the work, the patient is doing the work. And the therapist has to support the patient, and it's not, that's most important.
Valuable input. On the personal level, this directly touches on the need for integration work. Active integration work is a longer process that is very important.
Absolutely.
And on a macro level, you could say enculturation is also a huge topic, I think, that we really need to address in the coming years, even more so as the clinical application becomes even further spread out.
Absolutely. But you shouldn't forget that in the end, this kind of experience were done by endogenous people, and it was the vision of Hoffman that once maybe people who want to change their life or have a burnout or something like that have the possibility to go to a center. That's what I fight for now, or what I put my energy in, that kind of retreat thing. The medical thing is okay, and that's the key to open the door a little bit more, but that's not the full story.
Indeed, I fully agree, and that's why we also are very concerned, or it's important for us to also advance the field in human development.
Yes, exactly. Thank you.
Thank you for being with us today.